Hi there. Fatigue is one of the most misunderstood problems that my patients face, and it's rarely solved by one blood test. I'm Dr. Stephen Strong, a board-certified internal medicine specialist, and today I wanted to go through with you my workflow for addressing fatigue. I like to think about fatigue as the tip of the iceberg symptom. It's one of those things that can be caused by so many problems all at once, so it can be really confusing to navigate that as a patient. I like to separate fatigue into 4 buckets of categories that can cause fatigue. The first bucket is sleep quality and quantity. The second bucket is mental health and neurochemical balance. The third bucket is active medical problems and organic medical problems. And the fourth bucket is medication side effects or anything that's been done to you by medications or doctors. When you start to fractionate the problems of fatigue into these different buckets, it can make it much easier to find solutions. Let's go through each bucket one by one. The first bucket is sleep quality and quantity. This is kind of an obvious one, but I think it deserves a lot of attention. Most people know that we need at least 6.5, 7 hours of sleep every night, but there's a lot more nuance to sleep than people realize. There's several stages of sleep. There's deep sleep, there's REM sleep, there's cycles of sleep. It's really important to make sure that your body's going through each of the cycles every night continuously in order to have restorative sleep. One way that you can tell if you're having restorative sleep is if you're getting REM sleep, which is characterized by having dreams. Other ways to find out are wearables like Apple Watches or Oura Rings or things like that. But, we don't need to have those things to really determine if we're sleeping well. Many of the reasons people have, fractionated or disturbed sleep are things like dry mouth, waking up to go to the bathroom, aches and pains, disturbances like having dogs in the bed, having maybe not the best sleep hygiene, snoring or sleep apnea. There's a long list, but if you're facing fatigue, it's imperative that you do an honest assessment of your sleep and try to determine ways to improve that. The second bucket is mental health and psychosocial problems. I can't underemphasize how important this bucket is. This could be coming from something like clinical depression, a shift in someone's life like retirement or some major change like a move. It could be from somebody having a misalignment in their career and their marriage in terms of what they really want. But the mental health component in the fatigue assessment is extremely important. The third bucket is organic medical problems or active medical issues. This is one of the main reasons that patients come to see me in the doctor's office. Lab work, iron, thyroid, looking for inflammation, cancer, rheumatological problems, any of these things can contribute to fatigue. It takes a lot of clinical experience and judgment to be able to tell which of these problems is likely to contribute to fatigue more than others. But again, this takes an extremely careful review and oftentimes pretty extensive lab work for somebody who's facing fatigue. The last bucket is medications, anything that's been done to you by doctors like chemotherapy or surgeries. And again, it's extremely important to take a very careful medication history and to try to deprescribe where you can. Every single medication can cause fatigue as a side effect. Many medications are absolutely critical, and I'm not saying that we stop all of them, but in part of the fatigue analysis, it's extremely important to tease through all of these medications very carefully. So now we have the 4 buckets, and usually after I go through these with my patients, I like to estimate how much of each of these buckets is contributing to the overall fatigue symptom. For example, sleep in this assessment for one patient might be 25%, the medical problems may be 10%, the psychosocial problems may be 30%, whatever it ends up being, it can be super helpful to kind of characterize each of these problems and how much they're contributing to the overall symptom of fatigue. Again, once we start to get this framework, it can be really empowering for patients to have a more clear understanding and expectation of what's causing their fatigue, what can be done about it, and which part of the fatigue equation may be unfixable. Because again, this can help us strategize ways to help them. Let's go through an example to see how this might work. We have John. John's a 70-year-old male. He has a history of diabetes and hypertension. He recently retired from a career in finance. He's been told by his wife that he's been snoring more lately. He's gained some weight over the past 10 years. and he's doing some physical activity on a regular basis, and he's pretty active in his community. So right there's a lot of potential inquiries we can go through with John. For example, the sleep. Is he waking up in the middle of the night? How many hours of sleep is he getting? Is this snoring a new problem? Is there a chance he could have sleep apnea? The next part of the equation for John that I noticed is that he recently retired. Again, any major life event or life shift, like moving, having a kid, retiring, having a marriage that's chaotic, things like that, those are really influential in people's psyche and can affect fatigue. And I think one of the main ones that my patients face, like retirement, needs to be explained very carefully with the patient because that can be a big component. Then we see that he has diabetes and hypertension. Maybe he's on several medications for that we can adjust. Maybe weight loss for this patient could help us in two ways: deprescribing some of his medications and also helping him with his sleep by reducing his potential maybe sleep apnea, mild sleep apnea. Again, there would be a lot more questions I would ask John, but it takes a very careful analysis and fractionating it into each of these buckets to determine which of the potential causes could be resulting in his fatigue. So again, once we have this framework with fatigue, it can be much easier to navigate and to strategize and to isolate each problem, to find actionable steps and solutions to fix as many of them as we can, and then to follow patients over time and see how things evolve. I hope this framework was helpful for you. I really enjoy taking care of patients with fatigue because once you put the time and the work into it, we can really start to see changes happen. If you like this video, please hit like and subscribe. Thank you so much.